Welcome to this webinar series organized by the MEP Interest Group on antimicrobial resistance. My name is Jean-Yves Senwick. I'm with the organization Healthcare Autonomy Europe, which is together with the European Public Health Alliance, or EPha, co-hosting the secretariat of this interest group with the support of the AMR Stakeholder Network, the largest civil society-led network of AMR stakeholders in Europe. The MEP Interest Group on AMR, launched in February 2020, is the only AMR dedicated group in the European Parliament. It brings together 17 MEPs from across the political spectrum who are working together to make Europe a global leader in the fight against AMR. You can follow the developments of this group on its website and on Twitter with the hashtag MEPvsAMR, MEPvsAMR. In the run-up to European Antibiotic Awareness Day next week, the MEP Interest Group is organizing a series of 3 webinars to raise awareness on the need for action and find evidence-informed policy solutions to these urgent threats to human, animal, and environmental health. Today, we will discuss the environmental aspects of antimicrobial resistance. How can the pharmaceutical strategy address the environmental implications of production, use, and disposal of antimicrobials? How can the current water legislation be improved to better protect citizens from the risk of environmental AMR? What can be done to achieve a zero pollution ambition at the heart of the European Green Deal in relation to antimicrobial residues? And finally, what can be learned from member states to address environmental AMR? I'm now delighted to give the floor to MEP Nicolae Ștefănuța, Vice Chair of the MEP Interest Group, who kindly hosts today's discussions. He will give welcome remarks and introduce our speakers. MEP Ștefănuța, the floor is yours.
Thank you very much, Jean-Yves, and thank you to your organization for helping us with the secretariat of this very valuable intergroup. As you mentioned, next week we will be talking more about AMR, and this is an excellent event to start doing that already. Now, we always talk about how antibiotics are vital medicines in the treatment of bacterial infections, and without them, common infections would be fatal. But the effectiveness of antibiotics is under threat by the development and spread of drug-resistant bacteria. And we know the effects of antimicrobial resistance is a key health threat across the EU, with more than 33,000 people dying across the continent and with costs estimated at 1.5 billion. Now, it is even more important, and the UN Environment Agency has identified growing AMR linked to the discharge of drugs, in particular chemicals, into the environment as one of the most worrying health threats today. And wastewater treatment plants have limited capacities to remove antimicrobial residues, and the role of the environment as a reservoir for AMR is particularly concerning. Then, in addition to this, the pharmaceutical industry has outsourced antibiotic production to Asia, and close to 90% of antibiotic active ingredients are currently being manufactured in China. And because of the weak oversight and regulation, pharmaceutical residues are often discharged in the environment. Now, also the European Commission adopted last year a strategic approach to address the issue of pharmaceuticals in the environment. And this topic also drew the attention of the European Parliament, which adopted a resolution with a vast majority last September, noting with concern the soft nature of the measures, including the strategic approach, and making further recommendations. We believe that an important step will be the adoption of the new pharmaceutical strategy by the European Commission later this year. And finally, part of the European Green Deal, the Commission also committed to adopt a zero pollution action plan in 2021. All these are opportunities for us as politicians to make a wrong right. Now, my role here is not to give you long speeches, but rather to moderate and to introduce the speakers. I know I have 5 minutes, so do the speakers today, so that we will try to enforce a tight scheduling so that we can get as much information in the 1 hour and probably 10 minutes, because we started late, that we have available. First, I have Yayoi Lagerqvist, who's a researcher and co-author of the report, The Health Paradox, at the Swedish NGO Swedwatch. Then we have Nikolai Schaaf, who's a program manager at the Stockholm International Water Institute, a center dedicated to strengthening water governance and promoting a more sustainable future. We have Caroline Mormond. Caroline is a senior advisor for Pharmaceuticals and the Environment at the Dutch National Institute for Public Health and the Environment. And Hans Stielstra, who's the deputy head of the unit for clean water at the European Commission. So I give back the floor to you, Jean-Yves. You will introduce probably pass the floor to each of the speakers in the order you know best, and then I'll listen to the discussion. I don't know, do we have a few questions at the end?
Yes, indeed.
We do. In about 30 minutes, we have a Q&A, and then we have a sum up of our discussion. Thanks again for all those watching, for those participating, and let's hear what science has to say, and let's see what politicians have to follow up on. Thank you.
Thank you very much, MEP Stefanuta. Your welcome remarks gave, I think, an insightful overview of the topic and the discussion, and also of the political context around it. And we see that this issue is indeed particularly timely as the European Commission is developing its pharmaceutical strategy and its zero pollution action plan. So as you said, I'm now turning to our four speakers who have been invited to give short introductory remarks, and these will be followed by an interactive discussion during which we will take questions from the audience. So we want this session to be as interactive as possible. So please, this is your opportunity to engage with our hosts and our speakers. So don't hesitate to ask questions directly in the chat box. We will get back to them later on. Please also engage on Twitter with the hashtag of the MEP Interest Group on AMR, MEPvsAMR. And finally, I'd like to let you know that the webinar is being recorded and that the recording will be sent to you by email and published on the website of the MEP Interest Group in the next few days. I'd like to give the floor first to Yayoi from Swedwatch. Yayoi, you have led an extensive research on the environmental and human rights impacts from pharmaceutical production in India. And it would be great if you could give us an overview of your findings. So I would invite you to unmute yourself and share your presentation. Thank you, Yayoi. You can now see your slides. You just have to unmute yourself.
All right, good morning, everyone. My name is Yayoi Lagerqvist, and I work for an organization called Swedwatch, which is an independent non-profit organization based here in Stockholm. And our main focus is doing studies on human rights and environmental investigations on human and environmental rights across the business supply chains. In 2019, Swedwatch has conducted a study on pharmaceutical sector in collaboration with our partner organization, Swedish Society for Nature Conservation, and also local partners in India to examine the complex global web of supply chains in the pharmaceutical sectors. The study mainly highlighted the widespread environmental pollution from manufacturing facilities, and particularly the issue of highly concentrated antimicrobial resistant pathogens in the pharmaceutical effluents, which not only threatens global public health, but also fundamentally violates local community members' rights to a healthy environment. Our main message today for both policymakers and companies based in Europe is that affordable medicine here in Europe should not violate fundamental rights to a safe, clean, and sustainable environment. I'd like to move on to the next screen. We often question where our food and clothes come from, But when it comes to medicine, do we really know where our medicine come from and how they're made? So this question led us to Hyderabad, India, which is also known as a bulk drug capital. We visited Hyderabad last year in September 2019 and interviewed local people, as well as other entities, including human rights and environmental rights defenders in Hyderabad, as well as companies and also experts. And I suppose many of you are familiar with the fact that Hyderabad has become one of the global capital of bulk drugs, as global demand for generic drug manufacturing has been increasing since the 1990s. And more than 800 manufacturing facilities are currently located in Hyderabad area, producing critical generic medicine that Europe consumes. And during the last 2 decades, there has been growing attention on the extent of environmental pollution from pharmaceutical manufacturing facilities, and yet little is being done. So despite the legislations and institutional frameworks currently that exist in India to regulate environmental pollutions, what we find is that no manufacturer is proactively adhering to precautionary principles and mitigating manufacturing discharges due to fierce market competition in producing generic drugs. We've interviewed director of intermediary manufacturers that's based in Hyderabad, which seems to suggest that even though they're aware of this critical issue, everyone is dumping the waste, partly because of this market competition. And there are little or no incentives for companies to shift to environmentally sound manufacturing practices. And then also we've interviewed environmental and human rights defenders on the ground addressing these issues. Oftentimes, particularly because there's been increasing studies and attention casted on the issues. Companies has been building walls and cameras, setting cameras to inhibit further investigation. There are complex network of underground pipes coming from the factories so that it is much more difficult to trace where the source of the pollution is. There's also expansions, ideas of expansions of pharmaceutical production sites. And then there's quite a lot of land acquisitions in pursuance of expansion of manufacturing facilities. The heavy pollutions of both air and water, and then subsequently soil, is quite evident from scientific studies, but also as us being there in India, observing the sites. Community members that are affected by the businesses have lost their livelihood basis. Loss of income from fisheries due to the pollution of aquatic environments. Also, farmers that's been using groundwater for irrigations, they're unable to produce critical staple rice. And again, soil and water pollution also leads to livestock loss, which is again affecting people's critical livelihood basis. And then of course, people have limited access to clean water, and they're exposed to increased vulnerability to water shortages. Furthermore, there's no access to information or limited access to information regarding persisting environmental pollution. And there is limited grievance mechanisms that they can actually pursue to claim remedy to the environmental pollution. So today, I'd like to just quickly sum up and highlight key recommendations from our organization. You can read the detailed recommendations that we posited in the the link below. But the main crux of the recommendations that we would like to promote is that supply chain transparency in pharmaceutical sector needs to improve, and accountability of key actors involved towards the environment and human rights. This is also critical. And then furthermore, environmental risk assessments in the market authorization of pharmaceuticals needs to also include environmental risks from manufacturing discharge. And then, of course, strengthening the regulatory framework. This is already happening, but still, in order to pursue zero pollution, not just in Europe, but also beyond the European boundaries, we also need to be vigilant. And then furthermore, we need to promote responsible production and consumptions. This might also include things like green procurement of medicine. So I guess that is the wrap up in 5 minutes from Swedwatch. But if you would like to access our report, it is available through our website. So thank you. Back to you, Jean-Yves.
Thank you very much, Ayoi, and I will invite you to stop sharing your screen if you haven't done so. I think your introductory remarks really helped framing the discussions. So this is great, but at the same time also worrying when we hear sentences such as everyone is dumping the waste and there are no incentives for pharmaceutical companies. And I would like to get back to that later on during the Q&A discussion. Of course, for the participants, if you have yourself questions for Yayoi, please write them in the chat box and we will get back to them in a few minutes. I'm now turning to our next speaker, Hans from the European Commission. Hence, this commission puts sustainability issues high on the agenda with the European Green Deal. What has been the results from last year's strategic approach to pharmaceuticals in the environment in relation to environmental antimicrobial resistance? And what are the plans for the Commission to address this issue as part of the upcoming pharmaceutical strategy to be released in a few weeks and as part of the Zero Pollution Action Plan, which we expect to be adopted next year? The floor is yours.
Thank you, Jean-Yves, and good morning to everyone. I'm very pleased to be part of this event and to say something about what the Commission is doing in this particular area. Maybe a little proviso up front. I'm as you said, I'm speaking for. I'm working for the unit that deals with clean water in Europe, so the Water Framework Directive and everything that is associated to that. So while on AMR, of course, the responsibility, the overall coordination is done by the colleagues in the Health Directorate General. So I'm speaking somewhat under their control, if you like, but I can speak mostly to the environmental dimension of all of this. Yeah, just in my presentation, which will be without slides, I will be highlighting some of the actions indeed that we have proposed, so the policy papers that we have adopted and that we will still be adopting, and that hopefully form a useful hook for action on issues such as highlighted by the previous speaker and by the MEP in his introduction. So the overall framework for action from the side of the Commission is the One Health Action Plan that was adopted in 2017, which set out those challenges in terms of health and economy of the growth of antimicrobial resistance if that goes on unchecked. And it focuses on making the EU a best practice region, boosting innovation and research when it comes to AMR, and influencing also the global debate and global action on AMR, because it's evident also from the previous presentation that this is not a local issue here or there, but it's really something that's happening across the globe and as a result of our huge interconnectedness. When it on the side of environment, what we did is to adopt in early 2019 a Pharmaceuticals in the Environment communication that set out a number of actions across the life cycle of pharmaceuticals. So really from their conception stage to the waste stage, and we have launched a great number of actions, and we will be producing a progress report on that at the same time as the adoption of the pharmaceutical strategy, to which I will turn next. We were very pleased with the reception that it got from the political side. The Council has referred to it in 2 sets of conclusions. The Parliament indeed adopted this resolution. And I think it's fair to say that both the Parliament and the Council, while welcoming it, they were also critical about the level of ambition, and in particular calling for greater regulatory intervention in this area. And we've always said that that is certainly not something that we exclude, but that we need to follow the right procedures, but that we will certainly use any legislative opportunity that is presented, such as the Urban Wastewater Treatment Directive, that we are now looking at possibly revising. So yeah, I mentioned the progress report already. That will somehow appear at the same time as the pharmaceutical strategy, which is going to be adopted, if all goes well, on the 24th of November. I cannot say very much about that because this document is not finalized, of course. It's now at it's a bit up for debate now amongst at the political level in the Commission. Of course, I've seen various drafts. And I think it's common knowledge on the basis of the consultation what this communication is about. So it's not fully focused on AMR as such. It's really about the affordability, the access to medication, which was a problem already clearly on our radar screen before the current pandemic broke out. The competitiveness and the resilience of the pharmaceutical sector, and the ability of us collectively, I think, to deal with crisis situations that we are currently in. And so the global dimension is also there. Where does production take place? How are supply chains organized, etc., etc. And as part of that, it does include, it does refer also to antimicrobial resistance, and propose further action in that area. Actions that will not sound like a complete break with the past, but I think it's certainly reinforcing what has already been standing policy of the Commission since the One Health Action Plan. On the water side specifically, what we do within the EU is that we keep a close eye on the pharmaceuticals that we find in water, and antibiotics are part of that. We have a system, a so-called watch list, so a small number of chemical substances, including pharmaceuticals, that we collect data on to know to what extent they are a problem. There are some antibiotics there, and we have added a few more. And if we do find that these pharmaceuticals are a problem, we will include them on what we call the priority substance list. So under the Water Framework Directive, there is a list of, I think at the moment, 45 substances that once they land on that list, the member states need to make an effort to phase them out or to reduce their presence in water. And so if we do find that these pharmaceuticals at the moment are posing a problem, and these antibiotics do pose a problem, then we will be asking the member states to take action to avoid that, not that they can no longer be on the market, but at least to avoid that they end up in water. One little point I should make there is that what we look at is, our angle is not so much a spread of antimicrobial resistance, but our angle is direct toxicity of those substances to plant and animal life, or in the soil or wherever. But so that's our angle. Now, I don't think that the two things are incompatible with one another. I mean, the limits are set in such a way that if if we set them low enough, that will certainly also help to avoid the spreading of antimicrobial resistance. So I don't think that there is incompatibility, but just to say that we have a slightly different angle on AMR compared to what is maybe discussed in the health community. Perhaps I'll leave it at this, Jean-Yves. Yeah, sorry, let me just mention the Zero Pollution Action Plan. That you have mentioned as well. Indeed, we will by 2021, probably before the summer, around May or so, adopt this action plan, which the novelty of that is that we focus on pollution in general and on health effects of pollution, and that we try to do this in a cross-cutting way. So not only through air and water and soil, but that we also try to address pollution more across the board. And for that, we will be proposing some actions. Again, we're really now in the preparatory stage, so I can't really comment on what will be there. But we have just launched, I think 2 days ago now, an open public consultation. So really everyone can contribute to that debate and put forward ideas and actions that they feel that we should be including in that action plan. Thank you.
That sounds great. Thank you very much, Hans. Obviously, we'll be looking closely at these issues as these policy documents will be published, and we'll definitely get back to some of the points that you highlighted here, notably in relation to the list of priority substances during the upcoming Q&A discussion. Once again, for participants, I see some questions coming in the chat. If you have any questions for speakers, don't hesitate to post them here, and we'll try to submit them to our speakers during the Q&A discussions in a few minutes. I'm now turning to our third speaker, Nikolai from SIWI, the Stockholm International Water Institute. Nikolai, you have launched a new project to drive sustainability in the pharmaceutical supply chain in India, involving notably the private sector. Could you tell us a bit more about this responsible antibiotics manufacturing platform you set up? So I would invite you to unmute yourself and share your presentation.
Yes, thank you. Give me a second for the slides. I hope you can see them now.
Yes, it's working. Thank you.
Thank you. And thanks for the invitation, and thanks for organizing this important event. It's timely, as we have seen. There is a lot going on in this field. Just a quick background. SIWI, Stockholm International Water Institute, is a water governance institute. So we work in the space of who gets access to water, how and why. But we don't build or deploy technologies or build treatment plants or anything like that, just as a disclaimer. But the challenges we are facing are then often in the space of what is almost like an idiom, that the problem with water is that you have either too much or too little, or when you have it, it's too dirty. And this is, of course, how it ties in also to the issue of pharmaceutical pollution and AMR. But otherwise, we work in the field of water governance and transboundary collaboration, access to safe water and sanitation on the local level, and all kinds of things. But this work on the stakeholder dialogue around emerging water challenges is something that we do at our department, Swedish Water House, that is government funded to raise international water issues in Sweden and among Swedish stakeholders, but then also contributing with Swedish expertise to these dialogues. So what we've done in our work with pharmaceuticals is, as a starting point, to look at this very simplified life cycle and working with the stakeholders along this life cycle from manufacturing to consumption and the waste and wastewater management part, to see what are the emission pathways, who are the stakeholders there, what is their responsibility, but also what's their operating space, because it's a very complicated and highly regulated market, and it's not so that everyone has all freedom to do whatever they want. Doing this in Sweden and starting also with a Swedish stakeholder dialogue, we had to I'm happy to acknowledge really that there is a lot going on in responsible usage, both on pharmaceuticals in general, but especially on antibiotics. And it's very restrictive usage based on thorough diagnostics in the standard cases. And there are also efforts to address the challenge of wastewater management and advanced technologies. So addressing the environmental part here in Sweden is something where we do see some progress. It's not that everything is done, but we find some good progress, and we felt that the added value that we could give there would rather be in looking into what can be done with the manufacturing emissions, and then realizing that then we're talking about recipient water bodies that are in other parts of the world, especially in Asia, mentioning India, China, but there are a lot of other production hotspots. And what we found is that there are no standard criteria on how to address this. If you go to a supermarket and just look around, you see a jungle of sustainability labels for all kinds of products. And it's rather an issue of understanding and trusting in what they do. Here it's the other way around. There is a big need for harmonized and mutually accepted standards how to solve this, but they're not available. And we do see some progress here and quite some momentum to pick up these issues. We've been working in this space now for a couple of years, starting also with a strong collaboration with the UN network on sustainable procurement in the health sector, and in dialogue with industry representatives and procurers, for example, in the Nordic countries, who have been very proactive on this. And we found that procurement is probably the market segment where we see the largest operating space right now, and also the largest momentum. But other aspects of regulation have been mentioned earlier, where we think it's very important to keep in mind that procurement can be a pilot area to inform decision making, and also in other parts. But I also want to highlight that there's more to water and AMR and environmental health than I'll cover here, just since Yayoi also mentioned the human rights aspects. Talking about access to safe water and sanitation is a crucial part in the fight against AMR, because it reduces the dependency on antibiotics, and in that way also the vulnerability to AMR. And as Hans was also mentioning, there are different aspects how you assess ecotoxicity, and this leads to the approach that we are now rolling out in the responsible antibiotics manufacturing platform, builds on the finding that there are a lot of strategies, a lot of shared objectives in addressing this challenge. We need to reduce the emissions from antibiotics manufacturing because they are one of many drivers of AMR, and they are in the field of very specific responsibility of a specific group of stakeholders. And we want to address that by working with the pioneers who actually have let's say, an unspoken consensus on what they want to achieve, because national action plans on AMR do address that. Actually, in India, there is the first regulative draft in the world to address this issue through maximum effluent concentrations. Procurers want to impose sustainability criteria, but the different ends need to collaborate, because none of these actors can achieve that on their own. The industry wants incentives to trigger the improvements that need to happen, but ultimately we need the physical change on the manufacturing level, that the effluent and the waste streams improve. But for an incentive provider to be willing to reward that, we need to improve the flow of information. And this is the wheel that you see in this kind of logo that we want to help starting to spin a little bit more, so that the flow of information that I would see as one of the key bottlenecks right now is improved to help incentivizing those improvements made. We do that in collaboration with pharmaceutical companies like GSK and Centrin Pharmaceuticals, a Dutch antibiotics manufacturer. We do that in close collaboration and through strong advice through the Industry Alliance, who own the methodology that we're testing, and actually starting with the feasibility study and the first factory level work these days in India, in a factory outside Bangalore. and it's supported by the Swiss development agency, SDC. And I think just as an outlook, it's really important to listen into what Hans was saying, the flow of information. Do we know what we are measuring? Do we have science-based targets that everyone can agree upon? Then we can start developing joint solutions. Then we can address those pioneers through technical pilots on the factory level, showcase how emission reductions can be achieved, and mirror that on the incentive and procurement side. How does procurement work? How does that provide an option to integrate these kind of criteria, incentive criteria, and how can decision-making be improved there? This is where, and again, I'm tapping in, referring to what Hans just said, it's a complicated field, and we appreciate all the initiatives that we see also on the European level and on the level of many member states. It is symptomatic that these fields fall between the cracks a little bit, between environment and health. Procurement is usually in completely different departments, more in the economic or finance segments. So it's very great to see that even within the Commission, there's an awareness of the horizontal dependencies, and through RAMP, we hope we can contribute to that. You'll find more information, also the white paper that is kind of the foundation for the approach on the website. Feel free to reach out. We are interested in getting more partners, industry, policy, regulators, procurers on board. Reach out, let us know. Thank you.
Thank you very much, Nikolai. I would invite you to stop sharing your screen maybe. And definitely we look forward to seeing the outcomes of these innovative projects. And as always, if you have questions for Nikolai, please write them down in the chat box and we'll get back to them in 5 minutes. Finally, I'm turning to Caroline from the Dutch National Institute for Public Health and the Environment. Caroline, I believe you are going to tell us more about the Dutch chain approach, the premier project you're involved in, and the work carried out in the ad hoc working group on pharmaceuticals and the environment of the Pharmaceutical Committee. You can unmute yourself, and I think you had some issue to share your screen, so I will share your slides and I will ask for your advice on how to move on.
Thank you, Jean-Yves, and also thank you for asking me to present our work here. As you already said, I've got a lot of topics to cover, as you asked me, so it will be really quick. If anyone wants to have more information on any of these topics, just please contact me. My email address is my name, caroline.moermans@rivm.nl. Well, first of all, I'd like to show you the Dutch chain approach. So now we're more or less moving from production locations elsewhere in the world also to what is happening in our own waters. And the Dutch chain approach was started in 2016 in order to have every party along that chain, from development, authorization of pharmaceuticals, the distribution, the use, the prescription by doctors, and also the wastewater companies, the drinking water companies, work together to actually get an action plan and all do their thing within this chain approach. And to start with, there are a few basic principles within the chain approach. And the first one is very important. No pharmaceuticals are forbidden. The interest of the patient stays the most important. But next to that, the chain approach should also be pragmatic. It should be effective and efficient and at a societally acceptable cost. So we are constantly searching for what can we do and what is not feasible. And another important one is that all these parties act within their own possibilities and they do not wait for others to start. And they do not also, that's also an important principle, we're not going to point to another party and saying, I'm not going to move unless this other party is also moving. And that, if you could click, has now also recently started for the organization of the general practitioners, who have now started to write environmental considerations into their guidelines, which is really a new start. They don't have to do it, but they're starting to do it now for 4 substance groups. And we're, of course, really happy with that. It's really difficult, though, to put that in these guidelines because of a lack of information. It's often not possible to say which would be a good alternative for a pharmaceutical with known environmental issues. Next, please. So part of the chain approach is also measuring in the water what is actually the problem. And this figure is from a recent report that we published last month. These measurements are from 2018, all kinds of measuring monitoring locations in the Netherlands. And we had in 2018 a total of 117 substances that were monitored once or twice or 400 times. And what we saw is that for those pharmaceuticals where we had a risk limit, a PNEC, and measurements, that was this subset of pharmaceuticals. And there you can see that quite a number of pharmaceuticals at some time exceeded these risk limits. And if you could click again, some of these are actually also antibiotics, which is what we're talking about today. So they exceed the risk limits for ecotoxicity, but if you would compare that to risk limits that the industry has provided on AMR, for at least one of these substances, that risk limit is even more critical. And besides that, some of these antibiotics are on that European watch list that Mr. Stielstra also talked about. And as you can see, these limits are indeed exceeded. Next, please. If we then look at the total of these 117 substances, the red block is the one that's the number of substances where these risk limits are exceeded, who do have a risk. Then the green blocks are the substances which are measured, but where the risk limits were not exceeded, or which were measured, but which were below detection limits. So those are fine. Then the yellow one with the 12%, there we have measurements, but we don't have any information on risk limits. So we don't know about how much of these compounds exceed these risk limits. And the gray box, that's really a black box. We have measurements which were not above the detection limits. But what we see also a lot of times is that the detection limits are not low enough to actually measure these compounds on the level of the risk limits. And these gray blocks, we don't have any risk limits, so we don't know whether or not a compound being below detection limits is also actually safe. Next one. So what we still need is data on environmental risk limits. Next one. Part of the way we're going to solve that, and I'm really happy with that, that's the Premier project. So the Premier project started last September. It's a large project funded by the IMI, the Innovative Medicines Initiative, which is partly funded by the Horizon 2020 program. And as you can see, a lot of the partners in that work are industry and universities, but also the European Medicines Agency is part of that project, and we are also part of that project. And within this project, we're going to construct a really large database with a lot of environmental information on pharmaceuticals, also with an assessment system that water companies can use to assess it when they find pharmaceuticals in their waters, what would be the problems for these pharmaceuticals. And the industry has promised that for the 25 pharmaceuticals which end up highest in the prioritization exercise, for which we don't have enough information, they will test those 25 substances. So if you want to have more information about that project, just contact me. But I'm really, really happy that we're finally going to build this database. Next, please. Now, moving on to antimicrobial resistance in the environment. Next. I also want to show you a few issues of what we've been working on in the Netherlands. So we have a national Dutch action plan on sources and emissions of antimicrobial resistance. And what we then see is that municipal wastewater really has a larger contribution than hospital wastewater to antimicrobial resistance genes in the environment. And we're talking about 90% versus 10% more or less, with a little bit of variation there. So treating hospital wastewater as a source point of antimicrobial resistance, at least in the Netherlands, doesn't seem very useful when it's just a small part of the total of the antimicrobial resistance that can be found in municipal wastewater. Next. What we also did is we looked at the relevance of human exposure in recreational water, so people swimming in waters. And what we then see is that this environment does add to the transmission of antimicrobial resistance. It's a measurable contribution, it's modest, but it's there. And especially people, long distance swimmers, for instance, who are in the water very often, they really have quite a contribution of antimicrobial resistance, exposure for them. Next, please. We also are part of some international activities like the Tricycle Project, a WHO project, and we look there at the relation between poor water quality and sanitation, which is, of course, in many countries in the world, what people are actually dealing with, and antimicrobial resistance. And what we see there is that there is indeed a link between water sanitation and hygiene and the formation of antimicrobial resistance, and that really needs strengthening also on a global scale. Next, please. I want to end with a couple of remarks that Jean-Yves also asked me to do on the ad hoc working group that was instated by the European Pharmaceutical Committee. That's a member state committee in Brussels. So what Hans Stielstra said, the EU Commission has published a strategic approach on pharmaceuticals in the environment, and they've asked the Pharmaceutical Committee to come up with recommendations and best practices which would be within the possible actions of member states. So that doesn't have to be arranged by the commissions. That's something that member states could do. And we have 7 subgroups, part of the mandate that we have, working now on these different topics. And the topics are, for instance, promote development of guidelines on prudent use of pharmaceuticals for healthcare professionals, but also medical training, professional development programs, exchange best practices on advertising and prescription of medicinal projects, and how can that be applied in the choice of the therapy. Next one. And an example here, for instance, on the prudent use, it's a Dutch example going back to the antibiotics again. So if I would go to my general practitioner with a sore throat and I would ask her for antibiotics, I would first have to give a few drops of blood. She will put that in a small apparatus. And within 5 minutes, that apparatus says whether or not I have an infection in my blood. If I don't have an infection in my blood, I can jump high and low, but I will not get antibiotics from my general practitioner. Next, please. 4 other topics: reducing waste by optimizing the package sizes, and also looking at expiry dates, but also the safe disposal of these medicinal products, and collection of pharmaceutical residues as appropriate. And you can think, for instance, of the collection of X-ray contrast media by using urine bags. And then collection schemes, which is also something for unused pharmaceuticals, also the waste part. And then the last part is to provide recommendation on the actions under section 5.3 of the strategy, and that is improve the environmental risk assessment and its review. And then the parts of those that fall under the competence of the member states. So that is like improving the expertise of the people actually performing these environmental risk assessments. And then to end again with something that links back to the antimicrobial resistance. Next, please. I want to show you another Dutch example of information we are giving now to general practitioners and other doctors on fluids medication that still a lot of people tend to throw away through the sink. Also, when people get fluid antibiotics, there's always a little bit left in that bottle, and people really think they're doing a good thing by cleaning the bottle in the sink and then putting the bottle with the old glassware. And of course, that's not the way it should be. The bottle with the leftovers should be brought back to the pharmacies. And that is one of the things that we are now really focusing on also in communications to the public. Well, and that was what I have to say about what we're doing in the Netherlands and a bit in Europe. Thank you.
Thank you very much, Caroline. This is very much appreciated. I think I'm going to just remove the slides from my screen here. Just give me a sec. Excellent. And I think we can move now to the interactive discussions. I think that time is running out, but we started a little bit late. So if that's okay with you, we'll stay a bit longer for the Q&A session, which I think is perhaps and the opportunity for the audience to ask questions directly to our speakers. And I have a first question for Hans regarding the list of priority substances that you mentioned during your introductory remarks. Notably because my understanding is that the Commission is currently in the process of updating or proposing an update of this list and proposing to add pharmaceutical substances for the first time on the list of priority substances. And in the list of substances that are under consideration, there are currently 2 antibiotics. So I just wanted to have your views on what that means in terms of environmental AMR and what would be the expected timeline for such a process. Hans, the floor is yours.
Okay, yeah, very quickly, because there's not much time. Yeah, we're looking at whether such a review is needed or not. I would put my money on yes, it is needed. If it comes out by 2022. So that would then be a proposal of the Commission for a revision of the list of priority substances. Yes, we are looking at the antibiotics that have been on the watch list or that are currently on the watch list. I'm trying to find their name now. I don't know if I can. Don't have the right document in front of me. But in any case, yes, we will consider putting antibiotics on the list. In line with the normal legislative revision processes that we have in the Commission, we will be putting out what we will change, what we intend to change for public consultation. So you will be, everyone will be fully consulted on that. But I can't tell you now whether and which ones we will be putting on.
Okay, thank you very much, and that's also something we'll keep a close eye on in the coming month. My next question is to Yayo. As you mentioned in your introductory remarks, everyone is dumping the waste, and there are no incentives for pharmaceutical companies. So, what is your argument to push the pharmaceutical sector to develop or integrate more sustainable supply chain?
Yes, thank you. I think as one of the speakers, I believe it was Nikolai who mentioned, this is probably an issue across the board in the supply chain and also involving not only producers of different nodes, but also the consumers as well. But in terms of manufacturing facilities, as I mentioned, when we interviewed the companies, they are aware of the issues. And yet, for them to keep producing medicine, which for them, it's very difficult for them to introduce environmentally sound technology or ways of managing, because that would also mean that the cost of producing the medicine would increase. And therefore, if no one else in the sector is adhering to tighter environmental regulations, then why should they continue? So that was the statement coming out from one of the manufacturing factories that we interviewed. Having said that, if there are incentives for companies shifting to environmentally sound, good management practices, they said that they will be willing to do that. But then that also means that there needs to be a monitoring and surveillance of effluents. And of course, there needs to be certain standards that speakers have mentioned about, coming and measuring the effluents. But then also for the the consumers or at the various levels of supply chain, they also need to be aware of the information so that they're actually buying a product that meets that standard. So again, it comes back to the issue of transparency of the information. And I believe pharmaceutical sector is one of the least transparent in terms of the information. For instance, you buy a packet of medicine, and it's often difficult to know where your actual medicine came from. So perhaps there needs to be an industry mechanism put in place. So not only legal measures, but also voluntary measures from the pharmaceutical sector is also required. But again, we need to be vigilant in terms of how transparent the actual manufacturing practices are.
Thank you very much, Ayo. And I think, Nikolai, that's also a question you might be interested in commenting. Also in relation to the one project you describe, and a follow-up question for you directly, also related to the one project, because here we're talking about the pharmaceutical industry as a whole. And of course, some pharmaceutical companies are more front runners than others. And in the one project, you are engaging both with Century and Pharmaceuticals and GSK. But how can we engage with the pharmaceutical industry as a whole in driving sustainability in the pharmaceutical supply chain?
Thanks. I mean, it's a huge global industry. So, and looking at other markets or industry sectors, I mean, it's a long way to go. But talking about those, let's say the voluntary aspects in it, then those companies who are members in the AMR Industry Alliance are those who have committed to working with the so-called antibiotics manufacturing framework that has set PNEC values or maximum effluent concentrations, or like assessing these environmental impacts. But even there, I mean, they're quite large, and I think covering maybe 30% of the global market. But the idea with RAMP is also then to go beyond that and to start scaling. But also, and that's again important what Yayo mentioned, the aspect of transparency, of showcasing this can really be done. How does it work? How can a procurer get access to the information, evaluate it, get it verified, and use that to make a difference in the procurement decision? That is still the bottleneck. So on the one hand, we need a harmonization there on the level of methods. Then I believe, and I think that was also one of the topics in the chat, then I think that could be also applicable for other market segments and anyone who could or wants to impose criteria on manufacturing. But it also, there's another challenge in there, and that is on the environmental part in it. And I also saw a comment in the chat about like there's more to AMR and antibiotics in the environment than just manufacturing, obviously. But we do not have the monitoring tools, whether the emissions come from manufacturing or agriculture or municipal wastewater treatment plants. There is a gap in technologies there. So while we need a clear focus for this kind of work, and we're targeting the manufacturing, we believe that the methods developed can help us, and we want to contribute to addressing thinking about One Health, what I still think is kind of a blind spot when it comes to environmental health. Do we understand the role of the environment as a vector and as a reservoir, both for the APIs, for the active ingredients, and for resistance genes once they're triggered, and understanding which driver has what impact, what are the causalities, and then address the sources.
Thank you very much, Nikolai. I have maybe a last question for Caroline before giving the floor back to MEP Stefanuta. Caroline, of course, you mentioned about the pioneering role of the Netherlands in addressing pharmaceutical pollution, but also in developing diagnostic tools in terms of prescribing antibiotics or not. What can other member states learn from this experience? How can this Dutch experience be transferred to other member states across the European Union?
Well, I think, of course, the systems in every member state are different, the healthcare systems. So it's not simply copy and paste, but I think what other member states can learn from what we've done is that when you set up a chain approach like that, it's really important to actually talk to each other and not talk about each other. So talk with the healthcare sector and try to understand what they're coming from, and then for them also to understand why sustainability in general and pharmaceuticals in water in specific are a topic for them to discuss. And what we see now is that the issue of sustainability, which was not something that a couple of years ago the healthcare sector was very concerned about, currently is really becoming a big issue, with also a Dutch Green Deal on sustainability in the healthcare sector. So really the main message is to talk with each other, try to understand each other, and then make these general agreements like these are the boundaries between which we're going to work. And then you can actually have something like what we have, where doctors and pharmacists on a local scale have experts from water companies visit them, and then they have a 2-hour meeting on what they can actually do themselves to prevent pharmaceuticals from entering the water system. And people from the outside told us this will never happen. Doctors are far too busy to actually do this. And then within 1 or 2 months time after we spread the news that water companies were willing to do that, we already had 80 groups of doctors willing to have this meeting with these water experts. So the willingness is really there. So it's a question of reaching out to them.
Okay, well noted. So it's a question of engagement, but there is interest from the healthcare sector and healthcare professionals to engage on this issue. Thank you very much, Caroline. I see that time is already running out. I think we could have spoken for at least 2 or 3 more hours on this issue. It's really exciting. I'd like to thank all participants who joined today. We had more than 100 people joining this webinar. And of course, our host, MEP Stefanuta, and our speakers for their time and insightful contributions. And I'm now giving the floor back to MEP Stefanuta, who will close this webinar. MEP Stefanuta, the floor is yours.
Thank you. It was a pleasure to listen to everyone, and I think the main conclusion that can be drawn from today's webinar is that only comprehensive action can combat antimicrobial resistance. We need to act across the board in a variety of areas, in a variety of legislation, and that is why the concept of One Health is very important. That's why the budget that we just adopted this week for EU for Health, that is 3 times the amount that was initially planned, is also important, because I believe, and that was part of my work in the Environment Committee, that there should be a dedicated fund to antimicrobial resistance to look into the best inputs, because what Caroline, Nikolai, Yayoi, Hans, and everybody else said today, basically I could count at least 10 policy areas of the EU and another 10 that belong only to the member states. So it's very hard to find the exact input that needs to be done from the EU level that provides then value for the money, because we can do many things and not having an impact. So I see also Ludovico's asking me how the budget was cut from 10 to 1.7. I'm not going to go into that. I will just say that they're called the member states, and we fought for having at least half of what was promised, and we managed to get that. I liked very much the best practices example. I believe Caroline came with that. Prudent use, etc. I went away from this meeting with many good ideas. The environmental action, the water action, all of these things are very important. And we need to figure out the ways that provide the best value for the money, because the EU action is limited in this field, unfortunately. And I would like to see results, basically, of our action on AMR, because I recognize it personally as vice chair of this intergroup as one of the main challenges for our action, not only on health, but also on the environment and society in general. So thank you very very much for the discussion today. I took away a lot of things. I'm sure our viewers did too. The speakers were excellent. Thank you also for co-moderating this together with me.
Thank you very much, MEP Stefanuta. And I would invite participants to register for the two next webinars of our series. The next one will be taking place on Monday from 11 to 12, and we'll be discussing the dependence of EU food systems on antimicrobials. And the third one will be hosted by MEP Timo Falcon on Tuesday from 11 to 12, and we'll discuss how we can fix the antibiotic innovation pipeline. So I would like to say farewell to everyone. And of course, you can keep engaging with the MEP Interest Group and follow the developments related to this interest group on Twitter with our hashtag MEPvsAMR. Thank you very much and have a nice day.